Happy Breast Cancer Awareness Month. Say, in my role as president, CEO, and founder of Queen Street America, I'm often asked, well, Chris, help us understand the real reason why I should own a cancer policy for myself and for my family. So I thought I would take just a quick minute to illustrate, with the use of some very fancy graphics that I prepared, the logic behind our cancer insurance policy called the QSA Plan. Now let me direct you to these fancy graphics. Your cancer chances, if you're a woman, are 1 in 3 in your lifetime getting cancer. If you're a man, it's 1 in 2 over your lifetime. And if you are your family, 3 in 4 will experience cancer as a family in their lifetime. Those ratios, those chances are calculated by the American Cancer Society. Now, Duke University recently conducted a study of 250 specifically breast cancer patients. They determined that on average $712 was spent per month for out-of-pocket expenses. These are expenses not covered by their health insurance. 50% of the women spent less on food and clothes to be able to pay for their cancer drugs, and 43% borrowed money or used credit cards for cancer drugs. That is what happens when an individual or a family goes through a cancer treatment experience, in this case specifically a breast cancer treatment experience. Now, the Fred Hutchinson Cancer Research Center recently did a study out of their facility in Seattle, Washington, once again analyzing breast cancer patients. They determined that the cost of breast cancer treatment averages between $20,000 and $100,000 per person, and these costs increase with the stage of the disease. Once again, these are based on studies, in this case Duke Medical, and in this case Fred Hutchinson. Now, according to, once again, the American Cancer Society, the cost of cancer care is just not what's done by the hospital, by the medical facility, by the oncologist, and by the doctor treating you. The total cost of cancer encompasses so many things, and that's why the American Cancer Society tells us that 54% to 62% of the total cost of cancer care is non-medical in nature. These are things like deductibles and co-insurance and child care and lost income and living expenses and transportation and alternative treatments. These are the facts, folks. These are the facts. So the key question, and getting back to the earlier question about, Chris, why would I really need to consider a supplemental cancer insurance policy for myself and my family? The key question is, how would you manage the non-medical costs associated with cancer care if you were ever told you've got cancer? Would you dip into your savings? How about loans? Would you have fundraisers? Would you depend on family and friends? Would you use credit cards? Or, and here's the role that the QSA Plan plays. The QSA Plan pays an individual between $20,000 and $70,000 in the event that they're diagnosed with an internal cancer. That's money that's paid directly to the insured individual to be used for, in the case of non-medical expenses associated with a cancer treatment experience. Now, I illustrated, just to give you a sense of how affordable the QSA Plan is, I illustrated some monthly premium rates. These are based on an age category between 31 and 40 years of age, single individual, not using nicotine in any way. A $20,000 benefit would run $20 per month. That's all. A $30,000 lump sum benefit paid directly to you runs $26 a month. A $40,000 benefit level is $32 a month. A $50,000 benefit level is $38 a month. A $60,000 benefit is $44,000 a month. And a $70,000 benefit is $50 per month. So you can see, based on your family financial circumstance, how much coverage you want. You can fit the benefit level according to your specific family budget. So the QSA plan plays a very instrumental role. And let me just sort of recap by directing you to this now very sophisticated graphic. As I mentioned, the QSA plan fills in the gaps, those non-medical gaps, by paying you directly between $20,000 and $70,000. Now, this includes a wellness benefit that's already factored into the premium rates that pays charges up to $100 per insured per calendar year for certain diagnostic screenings and preventative tests. Let me point out, there are 14 of these diagnostic screenings and preventative tests, and this benefit applies to every insured covered in the policy. And let me tell you, there are because this plan is so very simple and straightforward. There are no complicated or expensive benefit features that you're paying for that you would not necessarily use. And we're always available to assist you with filing a claim. And in fact, one of the things we're very proud about at Queen Street America is that the claim form is basically a page and a half. You fill it out, your doctor fills it out, and you attach a copy of the pathologist report, send it in to us, and the claim is processed. And this pays in addition to any other policies that you may have. You know, we're really passionate about helping families deal with cancer. It's tough when you are fighting a cancer treatment experience. Paying for that fight should not be tough. That's why we offer to consumers now in over almost 40 states the QSA plan. Hey, thanks for watching. If you have any questions, please visit us on our website, www.queenstreetamerica.com. Bye for now.